Lecture number 1, Prevention of Dental Diseases. The topic of our lecture is Modern Principles of Organization and Methods of Medical and Preventive Care for Children. Preventive dentistry. What is it? Preventive dentistry is only a real beginning. You can reduce your need for us by taking care of problems before they become serious. Most dental disease is preventable if caught in time and taken care of. We all want a bright, healthy smile that lasts a lifetime. Taking care of your teeth is essential for maintaining good oral health and preventing dental problems down the road. The good news is there are some easy things you can do to take care of your teeth and prevent problems before they start. One of the most effective ways to keep your smile bright and healthy is that preventive dental care. In this blog, we explore the various types of preventive dental care and how they can benefit you and your patients. Preventive dental care involves practice and treatments aimed at keeping your teeth and gums healthy, preventing dental issues before they arise. This includes regular dental checkups, professional cleanings, and other preventive measures that help maintain oral hygiene of your patient. Preventive dental care should ideally begin in childhood and continue through your adulthood into old age. The primary culprit behind many oral health issues, either snaky film or bacteria known as plaque. This plaque sticks to teeth and gums, pasting on sugar and releasing acids and harm your enamel and gums. If left unchecked, this can lead to the formation of tartar, causing dental trouble over time. Fortunately, various types of preventive dental care practices exist to uphold a healthy smile and ward off oral health problems. Think of them as your shield against dental issues. Enjoying your smile, stay bright and healthy for the long time. Taking care of dental hygiene is important for everyone. Now we talk about why preventive dental care is so effective in nature. Spotting problems early. Preventive care helps us catch problems before they get worse. This not only saves your time and money, but can also be life-saving, particularly in cases where oral cancer is detected and treated promptly. Connection to overall health. The health of the teeth and gums is closely connected to our overall health. If your teeth are not healthy, it can contribute to other health problems. By prioritizing dental care, we can lower the risk of development many other health issues and other health problems. Economic efficiency or saves money. Preventing dental care issues is cheaper than fixing them later. Additionally, most dental insurance plans cover preventive services such as exams and cleanings, making them accessible and affordable. Positive dental visits. Preventive dentistry makes going to the dentist a good experience rather than focusing on addressing existing problems. You'll spend more time enhancing your smile and maintaining its health. The next positive dental visits. Preventive dentistry makes going to the dentist a good experience. Rather than focusing on addressing existing problems, you spend more than enhancing your smile and maintaining its health. Fever trips to the dentist, regular checkups, and preventive care, and fever visits for additional treatments. When the patients and dentists prevent problems before they start, they experience fewer dental issue and less discomfort overall. Preserving naturality of your teeth. Preventive care promotes the longevity of your natural teeth, allowing you continue enjoying the favorite foods and smiling confidently though your life. Enhanced aesthetics. Um, In addition to maintaining oral health, preventive dentistry can also enhance the appearance of your smile. When your teeth are healthy, the smile exudes confidence and radiance, contributing to overall well-being and self-love. Regular types of preventive dental care. The types of preventing dental care. Now that we are aware of the benefits of opting for preventive dental care, we look into the types of preventive dental care practices available. Regular dental checkups. One of the simple types of preventive dental care practice you can take up is scheduling regular dental checkups. They provide an easy path to maintaining good oral health. During the checkups, the dentist will examine the teeth and gums for any signs of decay, gum diseases, or other dental problems. Detecting and treating dental issues early can potentially save the patient's well-being. By scheduling regular dental exams, you can ensure that you are giving your smile the optimal care it deserves. Professional cleaning. What that mean? Professional cleaning. Professional dental cleaning, also known as prophylaxis, are now the most common types of preventive dental care. This preventive practice is performed by a dental hygienist. This cleansing involves the removal of plaque and tartar buildup from the teeth, which helps prevent cavities, gum disease, and bad breath. It is highly recommended to undergo professional cleaning every 6 months to maintain an optimal oral health. Dental X-rays. Dental X-rays are diagnostic tools used by the dentist to uncover dental problems that might remain unseen during a visual examination. Dental X-rays are capable of identifying various concerns, including cavities, tooth decay, impacted teeth, and bone loss. These X-rays play a critical role not only in early detection, but also in formulating effective treatment plans tailored to each patient's specific needs, ensuring comprehensive dental care. Dental sealants. Dental sealants are thin, protective coatings applied to the chewing surface of the molars and premolars to prevent decay. They create a barrier that seals out food particles and bacteria, reducing the risk of cavities. Dental sealants play a critical role in early detection and treatment planning in pediatric dentistry, allowing for comprehensive and care tailored to the unique needs of children and teenagers who are prone to cavities. Fluoride treatment. Fluoride treatments involve the application of fluoride to the teeth to straighten tooth enamel and prevent tooth decay. Fluoride helps remineralize the teeth, making them more resistant to acid attack from plaque bacteria. Fluoride treatments are often recommended for individuals at high risk of developing cavities, as they have been proven effective in reversing the condition. Oral health education, what that means? The dentists not only provide instructions on home dental care, but also offer guidance on brushing techniques, flossing, dietary habits, and other practices to promote oral health. They are dedicated to educating patients about proper oral hygiene practices, empowering them with knowledge to take better care of their teeth between dental visits. Additionally, they address any questions or concerns you may have, providing personalized recommendations to enhance uh, the overall health of the patient. Enameloplasty. Enameloplasty, also known as tooth reshaping, is a minimally invasive dental procedure aimed at improving the appearance and health of teeth. By removing small amounts of enamel to reshape the tooth surface, enameloplasty can correct minor imperfections such as chips or rough areas. Enameloplasty offers patients a convenient and effective way to achieve a more attractive smile while maintaining optimal health. Space maintainers. Space maintainers are orthodontic devices specifically created to preserve space for permanent teeth. They become necessary when baby teeth or primary teeth lost prematurely, aiming to prevent neighboring teeth from shifting into the gap. By keeping the space open, space maintainers facilitate the natural eruption of permanent teeth without any hindrance. The preventive measures ensures proper alignment and spacing of teeth, promoting optimal dental health in the long run. Terial extraction. Terial extraction is the dental procedure typically recommended for individuals in the process of developing their permanent adult teeth. This treatment involves the planned removal of specific primary teeth in a sequential order by a dental professional. By carefully orchestrating the extraction process, the aim is to facilitate the proper alignment and positioning of the adult teeth as they emerge, ensuring a harmonious and healthy dental upper and lower arches. This was the general information about about prevention of dental diseases and the main methods of dental diseases prevention. Now we tell about the definition, the term dental prevention or prevention. The natural history of a disease classified into 5 stages: underlying, susceptible, subclinical, clinical, and recovery, disability, death. Corresponding preventive health measures have been grouped into similar stages to target the prevention of this stage of a disease. These preventive stages are primary prevention, secondary prevention, and tertiary prevention. Combine these stages not only aim to prevent the onset of disease, though reduction, but also downstream complications of manifested diseases. Primordial prevention. In 1978, the most recent addition to preventive strategies, primordial prevention, was described. It consists of risk factor reduction target toward the entire population, though a focus on social and environmental conditions. Such measures typically get promoted though laws in national policy because primordial prevention is the earliest prevention modality. It is often aimed at children to decrease as much risk exposure as possible. Primordial prevention targets the underlying stages of natural disease by targeting the underlying social conditions that promote disease onset. Primary prevention, what that means? Primary prevention consists of measures aimed at the susceptible population or individual. The purpose of primary prevention is to prevent a disease from occurring, thus its target population is healthy individuals. It commonly institutes activities that limit risk exposure or increase the immunity of individuals at risk to prevent disease from progressing in a susceptible individual to subclinical disease. For example, immunization, a form of primary prevention. On the slide, you can see the influence of the oral health to overall health. And on the other hand, their general health can influence the oral health. Heart diseases, mouth cancer, diabetes, gum diseases, tooth loss, bad breath, dental decay, lung pathological conditions, and strokes. It is the main pathological conditions, general pathological conditions, which can affect oral health. Secondary prevention. Secondary prevention emphasizes early disease detection, and its target is healthy appearance individuals with subclinical forms of the disease. The subclinical disease consists of pathologic changes, but now are symptoms that are diagnosable in a doctor's visit. Secondary prevention often occurs in the forms screenings. For example, the secondary prevention aimed to diagnose cervical cancer and its clinical state before progression, or mouth cancer. Tertiary prevention. It is the form of prevention targets both the clinical and outcome stages of a disease. It is implemented in symptomatic patients and aims to reduce the severity of the disease as well as any associated, while secondary prevention seeks to prevent the onset of illness. Tertiary prevention aims to reduce the effects of the disease once established in an individual. Forms on tertiary prevention are commonly rehabilitation efforts. Today is known the quaternary prevention. It is the last form of prevention. And according to the International Dictionary, for general family practice, quaternary prevention is action taken to identify patients at risk of over medicalization, to protect them from a new medical invasion, and to suggest to them interventions which are ethically acceptable. These concept targets were mainly patients with illness, with dental illness too, but without the disease. The definition has undergone recent modification as an action taken to protect individuals, persons, patients from medical interventions that are likely cause more harm than good. On your slide, you can see the diagram and the types of dental diseases prevention: primary prevention, secondary prevention, and tertiary prevention. Primary prevention, well population, health promotion and addressing risk factors, social and genetic factors. People at risk of a health problem. For these people exists secondary prevention, screening of at-risk individuals, control or risk factors, and early investigation. And people with a health problem, for this group of population exists territory prevention. That means or includes rehabilitation, preventing complications, and improving quality of life. And put your attention on the screen once more. Patient category and the types of prevention on your screen, and you can visually improve understanding this information. Healthy, there are three main patient category: healthy, high risk, and the cured. Healthy group or health education required, health education and raising awareness, behavior change, and negotiate health goals, symptoms, recognize, accept the cure, and follow rehabilitation programs. Types of prevention for healthy people: primary prevention, high risk secondary prevention, and the cured tertiary prevention. I think it's simply for understanding, and we continue. All of you, I think, know that the prevention has to start from the prenatal period, before the birth. What does it mean? Prenatal primary prevention. Pregnancy is an ideal time to promote primary prevention of enamel caries in children, given the profound influence of maternal health and behaviors on children's oral health outcomes. Enamel caries is a multifactorial bacterial disease with Streptococcus mutans and the prime carriogenic bacterium, and strongly influenced by diet. The primary prevention includes only foods, supplements, natural, for correcting their diet, the normal diet of the pregnant women. Um, Perinatal oral health. Dentists have outcomes to recognize the critical role that the mother plays in ensuring her child's oral health. However, women often don't receive oral health care and education in a timely manner. Many women don't know that they should seek dental care during their pregnancy, while many others who do know this are often unable to visit the dentist who is willing to provide. Because new mothers are more likely to be receptive to ideas that would improve their oral health. Dental and obstetrics providers have a prime opportunity to educate mothers about the changes that could affect their children. It is important for general dentists to provide expectant mother with comprehensive dental care. As recent studies have shown that it is safe to provide care at any point during pregnancy. That includes prevention measures, diagnostic and treatment of oral diseases if necessary, including the use of radiographs in indications and local anesthetic. During pregnancy, exceed the risk inherit the treatment of those associated with not providing care, improving the oral health of expectant mothers by reducing their pathogenic bacterial levels with postpone the child's acquisition of oral bacteria and may delay the development of early caries lesion or enamel caries. Initial infant oral care visit. Infants and patients will be from an early infant oral health visit and the establishment of a dental at home. Explaining exactly what to expect during this visit may allay parental fears and concerns. Parents should be warned and children might cry during the visit, just as they would when they are hungry, tired, or placed in a new situation. Understanding these features of preventive methods uh, makes this preventive visit will help parents cope even if their child cries and is uncooperative. An infant oral care examination and caries risk assessment follow a simple six-step protocol as described below. Caries risk assessment. An individualized risk assessment of an infant told with help both healthcare providers and parents caregivers identify and understand the factors associated with enamel caries, early enamel caries, though that a cooperative and proactive preventive care plan can be developed, should be developed. Specific information gained from a systematic assessment of caries risk guides the dentist in the decision-making process to establish treatment and preventive protocols for children with oral diseases and for those deemed to be at risk. To achieve the best management and outcomes for good oral health, the caries risk assessment should be done as early as possible, preferably before the onset of disease. Caries risk assessment are a subsequent management of their disease in children is critical due to the known fact that caries in the primary dentition is a strong predictor of caries in the permanent dentition. Caries lesion balance concept state and the progression or reversal of dental caries is determined by the balance between pathological factors and protective factors. These risk factors are determined from interviews from their parents or caregivers and the clinical assessment. Caries risk assessment form provides an early way to comply and keep a record of the information that will aid the dentist in determining the infant child's caries risk. Form is broken down to their main categories: biological risk factors, protective factors, and disease indicators from a clinical examinations. Biological risk factors are obtained from the caretaker interviewer and include biological or lifestyle factors that contribute to the development or progression of caries. These risk factors includes a mother with active decay or recently placed dental restoration. Dental restoration. Family with a low socio-economic status and caregiver with low health literacy, and the child who frequently intakes fermentable carbohydrates or sweetened drinks and or sleeps with a bottle or a sippy cup containing milk or juice. General dentists have an important role in preventive and reducing the severity of early enamel caries in young children. By embracing the concepts of the dental home and perinatal and infant oral health, general dentists can implement preventive and treatment protocols in their practice by using an appropriate age-specific caries risk assessment instruments to determine the caries risk of their pediatric patients. The natural teeth, it's very important criteria for the best oral health. The primary responsibility of maintaining oral health lies with the individual or their custodians. These should be achieved through effective evidence-based self-care, but also needs to be supported by public health policy, education, the provision of professional monitoring, and therapeutic interventions when necessary. Self-care is most effective when individuals are oral health literate, demand a dentition that is functional and aesthetically appealing. On your screen, you can see 9 the most common dental problems. It is in WHO or World Health Organization, several governing bodies make prevention recommendations. For example, the USA Preventive Service Task Force is a governing body that makes recommendations for primary and secondary prevention strategies. The advisory community on immunization practice, though the Centers for Disease Control and Prevention makes recommendation for vaccination, while the Women's Preventive Service Initiative makes recommendation appropriate for females. Additionally, various the specialty organizations such as American College of Obstetrics and Gynecology and the American Cancer Society and etc. also make prevention recommendations with the multiply of information and recommending bodies It is often challenging for healthcare professionals to remain up to date on changing endorsements. Uh, for the while preventive services are regulated and must undergo safety testing, there is risk involved with prevention, particularly primary and secondary preventive factors targeted at intervening in healthy appearing individuals. It is often challenging to gain buy-in from the patients regarding the risk-benefit ratio of various preventive services. And finally, the cost of preventive services is commonly a topic of discussion. Several cost-benefit analyses have been undertaken regarding the evaluation of preventive services with varying degrees of confidence, while often a long-term gain of healthy life years is noted. Preventive services are not inexpensive, which can limit the use of these services by both the healthcare system and patients, and a consideration with promoting preventive services. Except this clinical significance exist in this issue. Preventive services have proven an essential aspect of healthcare. However, they appear consistently underutilized in their different countries. With cost, time, and resource constraints of physician, many preventive services get overlooked. Physicians need to remain up to date on the prevention guidelines and ensure all patients are offered appropriate service with a full explanation of risk and benefits. Noting allied health and interprofessional team interventions. Proper communication among the various healthcare personnel should be there to provide appropriate levels of prevention to the general public and patients. School staff and other auxiliary staff required education of the importance of providing prevention as an important aspect of caring for an individual's prenatal prevention of pregnancy is an ideal time to promote primary prevention. In children, prevention of early dental caries in children, given the profound influence of maternal health and behaviors on children's oral health outcomes. Early dental caries is a multifactorial disease. Except Streptococcus mutans at the prime pathogenic factor, carriogenic bacterium, there are another carriogenic bacterium. And these interactions between carcinogenic microbiological factors strongly influenced by diet. Studies have shown that maternal untreated caries and greater level of salivary Streptococcus mutans increase the risk of existing early dental caries in children. Children's dietary and oral hygiene behaviors rely on parents of caregivers' oral health knowledge. And beliefs and behavioral behaviors. While reviewed in the children dental caries risk model described in the literature of the last years, includes different levels of environmental elements, several factors that could potentially be influenced by mothers. Underlined in red, in microbiota and diet in the oral health element, positioning and the oral health circle. Health behaviors and practices, biological and genetic endowment, physical and demographic attributes, use of dental care, health behaviors and practices, and dental insurance that are included in the child level influences element, family position, socioeconomic status, physical safety, health status of parents, family function, culture and health behaviors, practices and coping skills of family that lie in the family level influences element. These factors in the dental caries risk prediction model for the their marginal role in existing or in appearance early dental caries development. Thus, in theory, oral health care intervention during pregnancy presents an ideal entry point to preventing early dental caries. The results of the contemporary the results of the reviews of the contemporary literature have shown a reduced early enamel caries incidence in children whose mothers received prenatal oral health care. ECC is a multifactorial disease with complex sociogenic, genetic, oral hygiene behaviors, bacteria, and diet factors that affect the risk for this disease. Streptococcus mutans, more recently Candida species, have been implicated as potential etiological microorganisms that may be involved in the initiation and development of ECC, or early caries. Studies have shown an association between marginal poor oral health and increased risk for ECC. The association between mothers and child's oral health could possibly be explained by the first mother's oral health behavior. Perception and knowledge influences the dental health of their children. The next, mother might be a main source of her children's acquisition of oral Streptococcus mutans and Candida species. The following points should be considered when interpreting the results of the reviews. Various intervention modalities and frequencies were used across the 5 studies, which produced challenges for data analysis. The heterogeneity of studies include the meta-analysis is significant. The timing of the main outcome measurement, ECC incidence with respect to children age lag consistently, though the next knowledge, the next study. The peak of ECC onset in 3 years of age. There is a significant increase and in incidence between age 2 and 3 years. In 46% ECC prevalence rate among children from the Brazilian continent, from 25 to 36 months of age. The next study includes a quantitative analysis only monitored study, children until age 2 years, which might have underestimated the preventive effect of prenatal oral health care on the development of ECC. So we are not enabled to collect study subject data on the other carriers determinants. It means demographic, socioeconomic, sugar contribution, etc. Given their multifactorial nature of early dental caries, their authors calculated might have under or overestimated the effectiveness of prenatal or oral health care. For the strategies that used prenatal or oral health education or primary prevention, it was not clear to what degree the prenatal oral intervention had improved or restored pregnant women's oral health. Therefore, it is challenging to make recommendations of how much oral health care a pregnant woman needs to receive and how much oral health education is needed to demonstrate effective early dental caries prevention in children. Taking the aforementioned limitations into account, future randomized clinical trials and desired to test prenatal oral health care strategies that maintain or restore an expectant mother's oral health and measure improvements of oral health knowledge. Moreover, another dilemma that needs to be considered is that although routine oral care during pregnancy has been demonstrated to be safe and recommendations for prenatal oral health care have been disseminated globally. Utilization of prenatal oral health care is limited in both development and developing countries. In contrast to the limited utilization of prenatal dental care, over 76% of women admitted to suffering from oral health problems, pain, bleeding gums, and oral infection during pregnancy, while more than 43% didn't have a dental checkup during pregnancy. Furthermore, dental care utilization during pregnancy was lower among women in the age 35-40 years old. Except this woman with socioeconomic disadvantages, thus oral health represents an important, often neglected health disparity during pregnancy among minority women and women with different social disadvantages. In order to use successfully prenatal oral health care to prevent early dental caries in children, further efforts needs to gain a better understanding of the factors that enable or inhibit the use of prenatal dental care at both the community and individual levels. Effective strategies might derive from collaboration among dental and medical providers involved, women's and children's dental and medical health, policy makers, and community social workers. What about their nutrition? The nutrition and dental health. Regional nutrition plays important a part in the forming of dental hard tissue, including mineral salts and vitamins between all women during their pregnancy and children before and after their disruption. Reactional nutrition is the use of all necessary products take like protein, fats, carbon hydrates, micro elements, vitamins, and water for healthy well-being. By the proper food ration is it possible to attain the increase of the concentration of mineral, salts and micro elements, vitamins in saliva to change buffer properties of saliva and relation to acids, which influence badly of the enamel of a tooth. One of the terms of valuable odontogenesis of a child is retinal feats of future mother in the period of her pregnancy. Mother ratio must contain the products rich by mineral salts, vitamins, protein, fats, carbohydrates. It is necessary to pay attention to the fact that the milk and milk products is the best source of mineral matters. There is much calcium in such products like rye bread, cheese, nuts. The balanced mineral composition of meal is instrumental in the assimilation of mineral salts. It consists in a clearly defined correlation of calcium and phosphorus from 4-5 to 1-to-1 magnesium and calcium. Such balance is in milk and his products, green stuffs, fish, fruit, mineral water. There is much of phosphorus in milk, cheese, fish, nuts. Optimum correlation of calcium and magnesium is in different milk porridge a number of elements in the product of C. As concern microelements, it is important to provide their sufficient receipt of flour, tea, saltwater fish, bulbs, meat, zinc, hard cheese, eggs, fruit, sea products, berries, magnesium, hard cheese, vegetable meal. Green stuffs, berries, fruit are the source of vitamin C. They contain a cellulose necessary for the best digestion as well as mineral salts. Meat, eggs, liver, buckwheat, and bread from the flour of broad grade contain the vitamins of the group B. We can find vitamin D in butter, liver. Carrot and C backbone contain vitamin A. It is necessary to remember that caffeine, alcohol, smoking, and instrumental in the decline of bone mass and going in for sports, the additional reception of fluoride, vitamin D, is instrumental in its increase. A ratio must be well balanced and must be foresee a limited use of carbohydrates, especially sugar, and enough amount of hot meal. To eruption, the teeth and the role of feet in their development. Calcification showed up only by humoral way and after eruption also though saliva and direct contacts with the tooth surface. The role of feet in caries prevention is shown in some aspects, in some three aspects. Feet as forming factor of caries resistance organs and tissues. Feet as a way of diminishing of carcinogenic and carbohydrates feeds is a factor of increasing of self-cleaning of oral cavity. Except the prenatal existence, the period of most rapid growth in humans occurs during the first 6 months of lives. Breastfeeding continues to be the best overall method of infant feeding, and breast milk could well be the infant's only food source of their first 4 to 6 months. Primary risk factors for early childhood carriers include putting a child to sleep at nap time or bedtime with a bottle containing a liquid other than plain water, allowing an infant to breastfeed at will during the night, and extended use to the northern bottle beyond a year of age. The mechanisms of action of fluoride. The fluoride it is very important component of dental enamel, dental dentine, and it is the important component for normal dental mineralization before and after eruption. The mechanisms of action of fluoride, it has an effect during tooth formation, making the enamel crystals lighter and more stable than hydroxyapatites. It inhibits plaque bacteria by blocking their enzyme enlace during glycolysis. It inhibits demineralization when in solution. It enhances remineralization by forming fluorapatite when in solution. It affects the crown morphology, making the pits and fissures shallower and hence less likely to create stagnation areas. Water fluoridation is systemic methods of providing fluoride on the community basis, 1 ppm. Fluoride was shown by into the optimum level in 1942, and dental caries is reduced by 40%. Other systemic methods of providing fluoride are salt, 40% caries reduction in different European countries. Milk, 15-65% caries is reduction, and mineral water, 46% caries is reduction in the countries of Western Europe. The principal requirement for community water fluoridation is a centralized pipe water supply. Other equipments are that it be economically feasible and politically acceptable. Other public health methods of obtaining fluoride coverage, especially for children, includes fluoridated salt, fluoridated milk, fluoridation of individual schools, water supply in the region, in the different region, if it necessary. Schools-based fluoride supplements program, school-based fluoride mouth rinse program. Salt fluoridation. Fluoridated table salt has been marked in Switzerland since 1945. Salt fluoride programs have been introduced in Colombia, Ecuador, Peru, Venezuela, and other countries in our world. Usually it is fluoridated at a ratio of 240 ppm. Milk fluoridation, it has been proposed as another alternative water fluoridation. It has been proposed fluoride supplement are in the form of tablets and drops. Caries reduction vary from 20% to 80%. The fluoride supplements doses depend on the age of the patients and the level of fluoride in the drinking water, in the country where the patient lives. No supplements should be prescribed if the water fluoride levels is greater than 0.7 ppm. Such supplementation is only maxillary effective if given long-term and regularly from 3 to 12 years, 200 to 140 days per year. Unfortunately, studies have shown that long-term compliance with daily fluoride supplement protocols is poor. Parental motivation and regular reinforcement are essential for such measures to be effective. The amount of fluoride in an organism depends on his maintenance in water and food products, and in general from the amount of water which drink, from traditional and habits which influence on the use of water and products. For the general prevention of caries, a point of fluoride inward in the pills of natrium chloride, a point in preparation of fluor. It is necessary to remember that a child for a day with a milk consumes to um, 0.3 0.5 milligram fluorine. The optimum daily receipt of this element must be within the limits of 1.2 to 2.6 milligrams depending on age. Fluoride, it is produced as pills which contains 0.05 milligrams fluorine or 0.5 milligrams fluorine in a baking for 100 pills. Pills except one time per day in the morning after breakfast. Duration, of course, 200 to 140 days in a year to the children from 3 to 40 years. The primary responsibility of my internal oral health lies with the individuals of their custodians. This should be achieved though the effective evidence-based self-care, but also need to be supported by public health policy, education, the provision of professional monitoring and therapeutic interventions when it necessary. Self-care is most effective when individuals are oral health literate and demand a dentition that is functional and aesthetically appealing. The dental care industry had an important role to play in the provision of effective, economic, and accessible products to enable self-care. Maintenance of oral health is largely achieved through toothbrushing to provide plaque control for gingival and periodontal health, combined with fluoride toothpaste for caries prevention and treatment. Self-care should also be supported by a healthy diet, refraining from excessive alcohol intake or use of tobacco, and regular visit to a dental professionals to assess any disease activity or increased risk that may indicate change is required. Except this, you have to understand that there are two types of risk factors. General risk factors and intraoral risk factors. General risk factors include health and neck radiation, current hypersalivation, oral hygiene practice, topical fluoride exposure, surgery drinks and sugary drinks and snacks, dental attendance, social economical status, mother's careers experiments. And on the other hand, active caries lesion, dry mouth, caries experience, thick plaque, exposed root surface, the appliances. All these factors can decrease the level of the oral health. And how can we recognize how can we organize practice to deliver effective prevention? Prevention care provision in dentistry has predominantly focused on the treatment of present in oral diseases in attending patients. This has largely arisen historically given the high of levels of disease present in the population over the last 2 or 3 decades. It has also been influenced by the way tourist reimbursement in link to treatment in interventions to serve demand, the way dentists are trained, and how dental practices are organized to deliver treatment services. First of all, it's very important things. It's public health policy. Public health policy supports healthy environments and access to care to provide both prevention and reparative interactions that are effectively remunerated, encourage oral health literacy and individual improvement. The numerous models of provision of oral care available, whether they are free and point of delivery, insurance-based or government supported, may all be adapted to provide these basic prerequisites. In defining public health policy, must ensure that the benefits of oral health are understood and promoted by all, and that messages are clear, simple, and above all consistent. Recent reports suggest that the profession is still unclear about simple oral hygiene measures, and touch variability and advice leaves patients confused about their role in securing and maintaining their oral health. And there may be a good case for dental organizations such as IADR or FDI to develop and agree simple, consistent, evidence-based guidelines for oral hygiene. Professional oral care Professional oral care. The role of the dental care professional is to monitor oral health and assess risk of disease progression, and in addition to the more widely perceived role of provision or operatively surgical interventions, their monitoring of oral health and their provision of or appropriate interventions when evidence of risk, the disease progression is identified, primarily achieves this. Once the disease is identified, this must be monitored to assess the success of any intervention, though appropriate recall strategies. It is recognized that this medical model of dentistry, while promoted for many years and supported by strong research evidence, is not always at the center of dental training programs, and many dental care professionals still graduate as proficient surgeons but lack the skills and knowledge to implement effective prevention. Dominant strategies. Given the definition of oral health provided above, and the roles and responsibilities of key stakeholders in the curing and maintaining oral health, what are the main evidence-based strategies to prevent and treat disease when self-care falls? The main strategies are summarized together with the quality of evidence to support them. It is emphasized that the quality of evidence needs to be from the level of anticipated benefit and the strategies represent the current stage of the art or disease control and prevention. The appropriate strategies for the individual and are depend on the level of risk and disease activity. Prerequisites. The strategies defined are based on the detection of diseases and sufficiently early stage to enable maximum benefit. If the disease process is too advanced, for example, gross carriers into pulp with periapical infections or advanced bone loss with highly mobilities, preventive therapies have little role in management. Community dental dental doctors have generally been focused on the detection of the disease at a stage where surgical intervention is required. If prevention in practice is to show real health benefits, there needs to be a paradigm shift and diagnostic skills and approach to ensure that the disease processes are detected at a stage where medical interventions can be effectively implemented. Detecting disease at this level can be complex and oftentimes it may be difficult to differentiate from health. How can we detect disease processes in a timely fashion? Those that prevention can work. The prevention sections consider the definition of disease, the nature of the role of self and professionals care, and the dominant strategies available to prevent and arrest early stage of oral diseases. However, in order to be able to enact these therapies effectively, disease needs to be detected, diagnosed, stage, and the risk of the patient assessed. The conference, the contemporary conference concentrated on the main oral diseases of caries and periodontal diseases. However, for completeness, we have also covered briefly tooth surface loss and oral cancer. You know that dental caries is a major cause of functional impairment of humors. Dental caries is the most prevalent condition affecting humans and has significant impact on the quality of life. Pain and may even lead to life-threatening infections. Dental caries is a complex multifactorial disease caused by an ecological shift in the microbiome following long-term frequent exposure to sugar or carbohydrate containing drinks, foods, or snacks, poor oral hygiene practices, and preventive care. Hence, to prevent the development of new caries lesion on short tooth surfaces, primary prevention, and to stop the progression of early or initial caries lesion, secondary prevention. Dentists must first stage the caries process and assess its risk factor. Staging of the caries progress and a prerequisite to prevention. Appropriate management of dental caries requires diagnosing non-cavitated lesion in enamel and the other of the sort of dentine. These lesions can be prevented from progressing through risk management and target secondary preventive strategies. Staging of caries may require both clinical and radiographic examinations. Clinical detection will require classification of teeth with active, initial, moderate, and extensive caries. Once lesions are classified, an appropriate intervention can be developed. However, the detection of lesion alone is insufficient to develop an effective preventive plan. Lesions occur within patients as individuals, and hence the assessment of risk factors and holistic treatment planning is essential. While a consequence of the most valid and easy to use risk assessment tools does not exist, and many are available. It is recommended, based on current evidence, the risk factors are considered. The current position, primary care provision in dentistry has predominantly focused in the treatment of presenting oral disease in attending patients. This has largely risen historically, given the high levels of disease present in the population over the last decades. It has also been influenced by the way service, medical and dental service and dental practices have organized to deliver treatment services. The consequence of this disease treatment demand focus are that attention becomes limited to dental treatment care. It means services and provided to meet present in a need or an episodic basic by the dental care provider, as opposed to emphasis on self-care to prevent future disease. The continuous attention given to explaining disease processes to promote healthy mouth and voluntary self-care, oral hygiene, healthy diets, supported by regular periodic professional care. As oral care or as oral health improves, services are not being delivered in accordance with the relative needs or relative risk or needs, or the distribution of these needs across different patient groups. Instead, the systems and processes of dentistry allow professionals into maintaining the status or service provision and responding to and including patients' demands and supply-induced demand. There is incomplete coverage of the population by dental care provision beyond the stable patient base of regular attenders that not only fails to address social inequalities in all locales, but contributes to these inequalities. There is a need for policy leaders to shift the focus from a traditionally surgical model of dentistry to an approach that concentrates on prevention by integrating mouth health with general health and social policies. Such an alliance with shift and focus in the oral health from technical interventions towards social determinants of health and to greater equity and social justice. These issues remain in many countries despite the use of different approaches to governing, delivering and funding dental care provision. This is largely due to the upstream nature of the social determinants of oral health and the downstream approaches to delivering care. If untreated, dental disease can have a substantial impact on individuals' health, functioning, and self-esteem, also giving rise to school work absence, reduction in productivity when at school work, and adverse effects on nutrition and development, particularly in children and adolescents. And enables for change. So what change must take place in order to support the development of an effective prevention strategy for oral health? In the rest of this section, we briefly identify and discard the possible elements of such a policy organization. This under three broad headings: financial insights, human resources, and governance. Financial side of this issue. Although many dentists are to adopt a preventive model of care, their systems in which they work often leads to such models not being structurally or financially viable, where dentist rewards are based on what is done. It is the here and now, as distant from the who it is done. For population-based, the quality of care provided is naturally hampered, and engaging in prevention may lead to lower practice income. By adopting alternative funding models that reward provided for engaging with hard-to-reach populations and high-needs groups, we can ensure that from a provider respective, the reach of their service pays appropriately. In addition, practicing prevention had the potential to reduce service needs at both the individual patients and the population level, though a halo effects and hence reduce workloads at the practice level. This then frees up capacity to serve larger populations and further increase coverage. This virtuous circle approach must be tempered with the fact that if hard to reach groups and assessed, they may present with logical need. Delivering this prior to the benefits of prevention being seen many impact to the perceived effectiveness of the approach, not least within the relatively short political cycles as compared to the relatively long disease processes of caries and periodontal condition. The next issue of human resources. The dentist may not be a most appropriate person to be delivering preventive care. Dental care professionals can be an effective and cost-effective part of the dental care team within a prevention model. The adoption of an efficiency built-in design and skill mix within the dental team provides an opportunity to use the team in a more productive way. Examples include dental nurses with additional competence and skills placing fluoride varnish and using motivational interviewing techniques, hygienists and therapeutists working to their full scope of practice to complete routine treatments and care preventive interactions in addition to screening, examination with the prevention focus of our outreach settings enable dentist times to be realized to focus on more complex service needs and high-risk need population. And the use of a wider skill mix within dental teams is in various stages of implementation globally, with some health systems readily accepting it, especially in areas where recruiting a more traditional dental workforce is problematic, but in others there has been a significant pushback from organized dentistry to resist the perceived erosion and of the dentist at the center piece of oral care delivery by demonstrating the value of skills mix and as an enabler for preventive care. The ability for dentists to develop more resource to complex patients may be realized. The next issue, patients' responsibilities. Understanding the importance of personal home care and eliminated destructive behaviors. It can be smoking, for example, become important factors for oral health. It's well known that both short-term improvement as well as long-term improvement in oral health can be obtained in patients, but this must be individualized to the patients. Otherwise, relapse will occur to baseline levels. To ensure acceptance, compliance, a significant aspect of care that immediately affects oral health in health literacy of the patients. Oral health literacy allows the patients to obtain resources that are necessary for management for their oral health. And the last issue, governance. The delivery of effective prevention is a matter of public interest given the broad social impacts of oral disease on the other hand, and potential risk of harm from care provided by training or inadequately trained providers on the other. Policies are therefore required to support prevention in practice that provide the appropriate regulatory framework to protect the public from harm and promote continual quality improvement in terms of training and competence of providers. They remove any impediments or restrictions on providers performing their full scope of practice, including but not limited to funding models that make adopting appropriate skill mix in the financial interest of practice owners now at their experience or those interests such as facilitating later dental practice and units that include preventive interview rooms in addition to surgeries. Governments, in conclusion, government's policy policymakers, insurers, organized dentistry industry, the professionals and patients all have a role to play in pushing clinical practice from surgical delivery of restorative treatments into care models of health promotion and health prevention. Impact of oral disease you can see on the slide. Overall, the adopting of prevention in practice represents a paradigm shift on the way we think about oral health care, with the focus switching from intervention to a model that promotes health according to individual needs and risk. At micro level, changes are needed in the way that dentists approach their routine examination. There should be an assessment of individual risk and an investigation of the patient's current self-care routine and circumstances to establish a complete understanding of their patient's oral health needs and environment. This can be achieved by completing a needs assessment and creating personalized daily self-care plan for every patient. This requires attention to be paid to the collection of the data that relates to an individual's risk, hygiene, diet, toothbrushing habits, and needs, absence of pain and discomfort, function, and self-esteem at the basis for tailoring preventive care based on individual needs. Excellent communications of the daily care plan is also essential. Dentists should be motivated by their potential for increasing rewarding relationships with patients, which encourage them to manage and take responsibility for their own oral health and prevent disease rather than being dependent on the dentist to cure problems once they occur. Again, such an approach would lead to the potential of increasing the capacity to care for the wider population who currently don't attend and where much of the body of oral disease resides. Preventive practice should be further encouraged, though federated local networks to encourage dentists to reach out into their communities and integrate with their partners. This will ensure that services are clinically led and clinically owned, with strong leadership forming the base for supporting effective service planning, quality improvement, and engagement. This is not without its challenges. It requires a considerable shift in the culture of dentists and their team to share good practice and become motivated, but the needs of the social population rather than simply by the demand of their stable patient base. It also requires the policy leaders facilitate supportive environments so that patients can adopt self-care messages and behavioral change advocated by dental teams. As oral health inequalities result from social inequalities in the conditions of a daily life. The special edition of oral health journal was produced in response to a perceived blockage in the transfer of research into clinical practice. The evidence base has for many years increasingly supported use of products, therapies, and interventions that have been shown to prevent, arrest, and reverse the commonest dental diseases that remain an issue globally. The development of diagnostic and staging system and devices combined with the recognition of the impact of risk on dynamic disease processes means that the disease processes can how be identified and appropriate stage where they are amenable to early interventions. Despite this, prevention in practice doesn't appear to be widely implemented. Governments, policymakers have organized dentistry industry for the best oral health. Thank you for attention.